doing a good seating massage on the neck and upper back is worth your time. When we are, say, combining Tuina with an acupuncture treatment, what will happen often is they'll sit down first, you'll do your neck and shoulder treatment and upper back, and then they'll lie down and you'll do the needles. So when we begin, remember our basic principles. We're always going superficial, deep, superficial. So as I'm sitting here talking, I'm just doing some very light pressing. I can do some pushing techniques, right? Just using the back of my hand. Very, very light. Now the whole idea behind this technique is just to introduce touch and be like, hey, I'm here. We're about to start working on this area, but I'm not using any deep force at all. And these introductory techniques, you take your time. You know, maybe it would be 5 minutes or so. You could work down into the lower back or the mid back rather. So I'll just stand on the side. This hand here is just for support, and I'll just do some light pressure. If you don't want to use your wrist like that, no problem. Loose fist is fine. Stand on the other side. I don't really like to stand like this and push because that's too much force going into the chair. If you have a proper massage chair where they can lie their entire chest against it and their arms are forward, go for it. But if they're just lying here, just use one side at a time. All right, and again, you would do that for much longer than I have. I'm just starting, or just doing the demonstration quite quickly. So then we're going to move into our deeper techniques. Now, as I move into those deeper techniques, the first technique I always go to is going to be I'll start with kneading and then I'll go into rolling. So with kneading, we could do one side or the other. If I work on this side, I'll just use the tips of my fingers. And this hand isn't doing anything, it's just there for support. If I go into the neck, the same thing. I can do both sides on the neck. Getting right up into that occipital region like we talked about. Feeling okay, Sammy?
Yep.
No pain? Starting to feel it though?
Yep.
Now gradually getting deeper. Very gradually. Use one hand, and although this looks like a grasping technique, I'm just using the flat sides of my thumb and finger to do more kneading.
And you want transverse process?
No, I'm right on the side of the neck. So the transverse process would be about here. I'm a little bit wider than that, about as wide as I can grip, because I'm just using here and there. It's very broad. And when I do this in the upper traps, that's kneading again, but now I'm just using my first metacarpal phalangeal joint. Okay. Then we'll get into rolling. So with rolling technique, we can either go up the neck or we can go down the neck, depending on the side. So if I'm going to go up the neck, I'll stand here and I'll get my rhythm. Now the problem with going up the neck is if you're not careful, by the time you kind of get to the base of the neck, you end up whacking them in the side of the neck a bunch of times. So I want you to be careful, right? As you roll up, you just have to be mindful that you're not hitting them in the side of the head and neck, right? So you can go down. Now you don't even have to go up the neck if you don't want to. You can just work on this tiny little spot. One thing we haven't done a lot of is isolate that rolling technique. So far we've done a lot of moving, but maybe I just want to locate one spot right around GB21 in between the spinous process of T1 and the acromion, right? So I'll just anchor that little knuckle right on the spot I want to work on. This hand will just be support. I'll just roll in that one spot. And remember, this is the beginning of our deeper technique, so I'm going to gradually increase the depth of this technique. But at no point am I going to get into that 7 realm, because for me to roll hard enough for her to say, yeah, that's a 7, it's too much force on that knuckle, so I wouldn't. I'm gradually getting deeper. Make sense, yeah? Okay, now rolling up and down the back in this position, I wouldn't do. It's too hard on my body mechanics. I mean, technically you could, but I find it very uncomfortable to go up the back, so I wouldn't do a rolling in that case, which means I'm going to be switching into pressing and suppressing. So pressing and suppressing, you can use your thumbs, you can use your knuckles, you can use the palm of your hand, whatever works for you, and I'm going to work just on one side at a time. So I'll work on, let's do, this side. So your non-working hand will just be support. You can use the tips of my fingers, I find it quite easy. So I'll find the spot, I'll just start to press, not getting into suppressing yet. Pressing down that mid-back. If I want to, and my thumbs are strong, I can press. I wouldn't suppress with them, it's going to be too hard on my thumbs, but I can really start to be specific. So I work down the mid-back or the upper back. In the neck, I could do the same thing with my fingers. I'll stand in this horse stance and I'll use the tips of my fingers, bring my elbows up so I can try and bring my fingers together. Doing okay? Getting a little tight?
Okay. The right side of my neck is tight.
You can use an individual thumb, so I'll show you on both sides. So if I'm just using my thumb like that, I'll curl the thumb in, right? Curl the thumb. I could just press. I'm not getting into suppressing yet. And the combination of these two techniques, going from pressing to suppressing, you have two choices. One, you can go up the meridian on each of the points with pressing, and then go back and find the point and do suppressing. Because you would not do suppressing on all of the points. It's too much. It's too painful. So you'd really just pick a couple points, right? For the most part, what you'll find is it will be Ding Chuan, or not Ding Chuan, Jing Bai Lao, and then it will be GB21, and then usually one of the 1.5 cell lines, maybe it's bladder 13, 14, 15, maybe 16. You pick one of those points. In this position, it's not ideal to be getting into GB20 and GB12 and all of those, so we're not going to work hard in our suppressing techniques up there. So anyways, I'll do my pressing techniques on both sides gradually, working. I'm going to be working on GB21 with my pressing techniques. I can stand here, I'll raise my body up, start to press with my fingers. And then within our suppressing techniques, so if I find a couple points that require suppressing, if I'm working on Jing Bai Lao on the neck, I can either stand on one side, this hand will support, and I'll bring my elbow up, and I'm basically just using the tips of my fingers. Now, if your fingers are hypermobile, this won't work for you, because you'll find your fingers will bend backwards. It just won't work. But that's one possible posture. Another possible posture is we use a reinforced thumb, so you'll make a relatively tight fist. You're not squeezing hard, just nice, loose, or relatively tight fist, and then you'll curl your thumb around your fingers. Now with your thumb curled around your fingers, you'll find that point. This hand will be support, and I could just lean in to that spot. You okay?
Yep.
Not quite, yeah. Tell me when we're at a 7.
Right there.
And as we know, we'll either wait until we feel it relax, or we'll wait until they tell us it's at a 4. Every time I do suppressing, I always like to do a little bit of kneading. If you're going to be doing suppressing technique on, say, GB21, then there's a few ways we can do this. One is we can do direct pressure again. I could stand at the side of the table, towards the front of the, standing at the side or towards the front, and I can lean in again with that reinforced thumb. This hand is just going to support my wrist, stack my body mechanics, and lean in. I don't particularly like this because once I start doing that, the force is enough that they have to contract their body to prevent from falling backwards. So what I prefer to do with suppressing, in this case, is I'm going to use the clamps. I'll squeeze. This isn't grasping. Remember, grasping is quick. This is still a type of suppressing. So I'll locate that point in between my fingers. And if I need to use 2 hands, no problem. I'll use 2 hands. And I gradually increase the force until we're at that 7.
Yep.
Yep. And we either wait until we feel it release, or until they tell us it's at a 4. Relax, do a little bit of kneading. Go back and do it again. Making sense? All good? Cool. Let me get down into the upper back itself. Now, to do pressing or suppressing techniques, again, we can use our fingertips. We can use our reinforced thumb. We can use our dual reinforced thumbs. We can use our knuckle. I would not recommend using your elbow here. It's going to be too hard to keep control. So if say I'm going to use my knuckle in this case, I would find the spot I want to work on. This hand is going to support, and I'll just lean in until we get to that 7. Now when I use my knuckle, I don't usually use the very tip of my knuckle. I try and use more the flat part. The reason is the tip can be very, very sharp and painful. So I'll use the flatter edge. Yeah. Cool? All right. Now, one thing I do want to show you